Hey guys, it's Michael again. Welcome to another one of our videos in the video series of how not to lose patients to other agencies. And that's the main goal of this series, is to be able to give you guys a bunch of different tips on how to be able to maintain current patients that are in your orbit, that are currently in your care for your company. It's such an important thing not to lose patients to other agencies, but also to increase more referrals coming in. And that's what we're here for at Home Health Success Academy with you guys, right? So let's go ahead and get started with this particular video. Now, we always want to talk to our patients. That's important. One of the biggest problems that a lot of companies, not even home health agencies, even other companies in other industries, is that they do not survey why they lost a patient, right? You want to ultimately be able to know what's causing your patients to leave your agency. When you lose a patient, don't just sign that transfer, beneficiary transfer for that patient to another agency. What you need to do is you need to be able to contact the patient. This is where your clinical liaisons, your staffing team works well. You need to be able to go to the patient and visit them. Now, when you lose a patient, don't go to them and start complaining and start begging them to just come back to you because you already lost them, okay? What you need to do is you need to then create what they call an exit interview and say, hey, we appreciate you being with us, but we would like to do an exit interview if this makes us better in the near future for our other patients. By you showing sincerity, you are going to be able to show them that you actually cared about them and you just apologized why you lost them. Find out what the reasons, find out from these exit interviews with these patients and with their family members why you lost a particular patient. You know, one thing in nursing is what they call the nursing process, and that's the ADPI: assess, diagnose, plan, implement, and evaluate. So, in the end of any patient, you want to evaluate whether it's a positive or negative thing, because especially the negative, right? You want to hear what are things that you can improve in this business, in this industry, in healthcare. It's always about continuous learning, and at the very same time, it's always trying to learn something new. And how do you find out what to do? Is find out what the needs and the wants are of clients. Now, I've seen in the past, some clients just have this thing about the grass is greener on the other side. They want to try a different agency, but they end up in the other agency. They found out the grass over there was brown, so they end up back in your agency. Does that happen? Of course it does. Is it going to happen that you might lose a patient and never come back? Of course you can. But it's a matter of being consistent. It's a matter of being evaluate your company, evaluate your staff. Maybe there's just something that you guys were lacking that you could have improved on. This allows you to be able to, first of all, take care of the patients even better, right? Because you value the patients. So when you hear that you have a problem, you fix that for the next patient. And at the very same time as you also get information about current employees that you have that might need to be fired, unfortunately. So that's the tip for this one. We have one more video, one more tip in this video series in regards on how to be able to not lose your patient to other agencies. So make sure you keep on paying attention. Always understand that this is Michael with Home Health Success Academy, and marketing with home health is easy when you know what you're doing.